Hi everyone, welcome to our channel. My name is Zetu. Today, I would like us to talk about the operation hysterectomy. What is hysterectomy? Hysterectomy is the surgical removal of the uterus. Uterus is also known as womb. Uterus is the organ in the female body that keeps the baby if the woman is pregnant. Question: why we have to remove such an important organ? To answer that question, there are some problems that can develop in the uterus. As a result of that uterus needs to be removed. In other words, what are the indications of hysterectomy? One of them is uterine fibroids. Fibroids are non-cancerous growths that develop in the uterus. These growths causes the problem of abnormal bleeding that is accompanied by pain. There are some other methods that can be done to treat the problem of fibroids. One of the operations that can be done to remove the fibroid is called myomectomy. But if the fibroids keep recurring, then the doctor will end up recommending for the hysterectomy to be done if that person is still having a lot of problem with those fibroids. Another indication that leads to hysterectomy or removal of the uterus is cancer. If there is cancer or if the woman develops cancer, that may need hysterectomy. Cancer can be in the uterus, it can be in the cervix, which is the opening of the uterus, or it can be in the ovary. In that case, the uterus needs to be removed as the treatment of cancer, although other things like chemotherapy or radiation will follow. But hysterectomy in the case of cancer is recommended. Another indication, it can be infection. Infection, if it's discovered early, infection like pelvic inflammatory disease, if it's discovered early, it can be treated with antibiotics. But if it's not treated in time, it can damage the uterus. As a result of that, the person will have a lot of pain, and that person may also need to remove the uterus due to that infection that can not be treated, or because the infection was not treated early, or the infection was discovered late when the damage was already done in the uterus. Another indication is uterine prolapse. It does happen at time that the uterus slips down from its place. And if it slips down, it slips into the vagina, and then it starts causing problems. And this problem of prolapse is more common to those female who had multiple vaginal delivery, and it would also common to those females that are going through menopause. Another indication of hysterectomy is hysterectomy can be done as an emergency operation if there is complication of delivery. Complication of delivery can cause a lot of blood loss, and then hysterectomy can be done as an emergency operation to save that patient who has suffered that postpartum bleeding. In this case, it's done as an emergency as to save life. Hysterectomy can be done as an elective surgery. It can also be done as an emergency surgery, especially post-delivery or post-cesarean section, as to save life due to massive bleeding. Another indication of hysterectomy, it can be endometriosis. Endometriosis is the condition where the endometrium grows out of the uterus and it starts damaging the uterus and it starts causing a lot of pain, and this condition may also lead to infertility. It actually causes a lot of pain if it's not treated. It can be treated, but if it's not treated, it will cause a lot of pain, and lately the doctor may recommend that hysterectomy needs to be done. There is quite a lot of indication that can lead to the removal of the uterus. As I've mentioned, it can be elective, especially in case of fibroids, in case of cancer, in case of prolapse. It can be planned. That's why I'm saying it's elective. It can be planned, but it can also be done as an emergency in case of complication post-delivery. If it's planned, it is very important for the doctor who's going to perform the operation to educate the patient about the operation, because it can affect a female psychologically to know that it's going to lose the uterus. Therefore, health education before surgery knows exactly what is going to happen when you are going for surgery, and knows exactly what is going to happen post surgery. Reassurance, it's one of the major important care that can be done for those female that may be losing their uterus. And it's also important to explain that you will still be normal being a female even if the uterus is removed, because there are so many myths that can go around with that if you don't have the uterus, of which some of them is not the truth. But if the patient is prepared mentally, you'll find that everything goes, and the patient will actually know the importance of having the operation to solve the problem that she must have been having before. For today, we will end up here. If you do like these short videos, please comment, please share, and subscribe. Thank you for watching, and thank you for support. Till next time, stay safe and stay